So she had ACL surgery, ACL repair and meniscus repair with a patellar tendon graft back in April, first week of April. So we're looking at almost like 5 months now, or around 5 months of rehab. So just working on kind of like those middle stages of the ACL rehab. So developing some strength back in that quad, kind of hip and knee control with both like double leg and single leg stuff, and just trying to gradually load that area where they took the tissue from at the patellar tendon, so that that knee can be exposed to like that forward pressure, which is inevitable when she gets back to playing soccer. Yeah, so we used the dynamometer roughly around the 3-month mark was when we took the first measurement, and strength numbers were good enough to start doing some of those plyo and running stuff. We have her doing some return to run programming on her own through her programming. I don't know if there's really anything specific. I'm just trying to get her to commit to loading that through the middle stages, because I feel like that's where the commitment to this rehab can be the most challenging, because it's already been 5 months and it feels like the longest rehab ever, but realistically it's minimum 4 more months to go, more likely closer to a full year, so another like 7 months, which can be challenging from the patient's perspective. And then over to the other side. Picture like there's a chair kind of behind your heel. Yeah, there you go. Keep going, 1 more each. We'll do 5 total. Any pressure with that?
No, nothing.
Feels okay?
Yeah.
Just kind of like stretch on the straight leg? Okay. Okay, let's do some of the running stuff. Was last time the first time we did any of the running stuff? Like the A's, the B's, the high knees? No?
Wait, yeah, no.
So just bouncing on each foot? Okay, same thing on the way back. Try to propel yourself forward a little bit more. Okay. And see if you can make it like less like skiddy on the
like
second
more like,
step.
Okay.
So I feel, yeah. So just butt kicks on the way down. Okay. Regular, nothing crazy. Yeah. Okay, and then we'll go high knees. Did that feel fine?
Yeah, that's fine.
No issue? Okay.
No.
Let's do a little bit of a lateral movement, which we haven't really done. Like I don't think we've done any karaoke or any pivoting or any lateral shuffle. So maybe we'll leave the karaoke for today, but let's do a little bit of a lateral shuffle. So we'll go sideways. Rather than doing it like your normal way, I want you to try and get a little bit of height in between. So it's kind of like a jump going sideways, rather than just like, if you know what I mean.
Yeah.
Okay. A little more height. Yeah. Good. Feels okay on that side?
Yeah, on this side.
Okay, let's go this way. Technically this side should be easier because it's the left. What'd you feel?
That side's like a lot harder.
With the right leg in front?
Yeah.
Why? What'd you feel?
Like I don't know, just like push, like I don't know.
Pain?
No.
Or like lack of power, strength?
Yeah, lack of power.
Okay. Let's do the same thing again on the way down. Same thing back. Because you're pushing off with the right here, but you're landing on the left.
Oh.
Painful?
No.
Just on the box, step off, stick the landing. We'll do a set of 5.
Okay.
Same thing we did last time. Yep. Cushion that landing. Try to absorb it as quick as you can, but as quiet as you can.
Okay.
If that makes sense. Yep. Okay. Do you feel okay trying this with some weight in your hands?
Yeah, feels good.
Okay. So same idea. You're gonna step off, absorb the landing. Try not to let that weight pull you down all the way, so you're in a deep squat. I want you to try and stop yourself in that like quarter squat athletic position. Yep. Okay, 2 more. It's the first time we've done it with weight, right?
Yeah.
Because I didn't write it down last time. No issue?
No.
A little tougher than no weight?
Yeah.
Did you feel tendon?
No.
No.
It was like, yeah.
Let's go on the plate. Same thing as last time, from one leg onto the other. Try and stick that landing. Let's alternate this time. We'll go 3 each.
Okay.
Yeah, same concept as both legs.
Yeah.
Just try to stick that landing. Yeah. How do they compare?
Like this side's like a lot easier. Like the left side.
To stop yourself or to stick it?
Like to stick it.
Okay.
Yeah.
Let's do same thing. We're gonna go sideways. We'll go from your left onto your right.
Okay.
Just stick it, step back up, go again. Okay, we'll do 3 and then we'll turn around. Yep. How does it feel compared to going forward?
It's like harder sideways. Like I don't know. It feels like I'm gonna like fall over.
Okay.
When I like land.
Not,
Like, I'm not, like,
pain or pressure
no.
though. Okay. Let's try for 6 with this.
Okay.
Good, driving through that floor. Last one. Nice. Actually looks better
Easy.
than a month ago when we squatted.
Yeah.
Why easy?
I don't know. It's just light.
Just light?
Somewhat light.
Somewhat light?
Yeah.
So you're saying put more weight on it, but not too much more weight?
Yeah.
Okay. With the box jump, landing on the box, I don't care so much about being like in a knee bend landing position. Like I'm more focused on the explosiveness coming up. So even if that means like landing pretty straight,
Okay.
that's okay.
Yeah.
Just make sure you clear the box and you land on it.
Okay.
Yep. Step down. Yeah. Okay. Outside leg down, inside hand on the bar. Down, back up. Every time you're coming back up, toe can go on the ground. I don't need you to fight for balance the whole time, just while you're doing the movement. There we go. Yep. One more. 5. Good. Let's go. So I want you to use this kind of like a slide board, so you can set up on the front edge, and then the other foot can be on the mat, and then you'll just slide backwards into your lunge.
Okay.
And back up. Okay?
Okay.
We'll do 6 here. 4. What do you feel? Pressure in the back knee?
No.
No issue in the back knee. Light?
Like, kind of.
Let's see what it looks like on the other side, and then we can judge. Last one. Good job. Can we go up to 20, you think?
Yeah.
No?
Like, yeah.
How do you compare left and right?
It was the same. They were both like hard-ish.
Okay. Now like line up the right foot with the edge of the mat. Yeah. And then as you go, try to keep toe against it as well. And then as you go, I want knee to kind of come outside this, so you're not running into it with your right leg. Yeah, better. Good, one more. Nice. Did it feel different?
Yeah.
Why? Like harder?
Yeah, it was harder.
Did you feel quad working?
Quad, yeah.
Okay. Do you feel glute?
A little bit.
More quad though.
Yeah.
Tendon?
No.
Okay. Leaning forward, arms straight,
Yeah.
marching one after the other. Just driving into that floor, thinking like almost pushing the turf back behind you as you go. Okay, walking backwards, even steps. Yep. Try to keep it smooth and consistent. Go that way just a hair. Yep, keep going straight. Nothing, easy.
Yeah.
More weight?
Yeah.
Okay. Driving through each leg. Try not to let your heel collapse towards the floor, especially on that right side. Good, toes facing forward, one after the other. Good. So just trying to get the work done, get that leg stronger, get that tendon to handle more.
Yeah.
So that we can do a little more running, some sprinting, and then get used to that change of direction,
Okay.
right? Because the landing stuff's all great when it's under control, but sport's not always under control,
Yeah.
right? So I think once those start to feel a little better with jumping off the boxes and getting a little more control out of it, we can add some single leg, like power stuff. Box jumps on a single leg. It's not necessarily plyos, but it's a little power, and then have to get into like continuous kind of jumping with both double leg and single leg as well.
Okay.
Okay. I'll let you do your thing for a couple weeks.